Hello, Amarachi. Don't scroll. Come back. You said you have a doctor friend, Abby. When last did you check on your friend? Yes, Amarachi. I'm talking to you. And I'm not talking about the time that you called her to ask for her opinion on the drugs to buy for that your 3-year-old niece that was coughing. Or the time you texted her with your mother-in-law's abdominal ultrasound scan results to help you interpret it. Oladipo, did you really think I would forget you too? You said you have many nurse friends. When last did you text any of them just to ask, how are you doing? And of course, I mean without following it up with a medical related request. Wow. So you really have to think that hard about it. Doctors are not superhumans, you know. They are human beings, just like you. Blood runs through their veins, just like yours. They love, they feel, and they have families, just like you do. They have emotions, just like you. So why then do we act like it's not so? I've read a good number of published articles and research on the prevalence of depression, burnout, and other mental health challenges amongst doctors and other healthcare professionals. And guess what? The rate is alarming. Imagine living in a society where there is so much stigmatization and discrimination against people living with mental health challenges. In fact, some of you contribute to this stigma. And yet, the very healthcare professionals whose hands you put your lives in suffer a disproportionately higher prevalence of these mental health struggles in comparison to the general populace. Then you really must be a clown to think mental health is a joke. Well, I'll tell you this much for free. Mental health challenges are very real, and as a matter of fact, they exist amongst healthcare workers too. So if you didn't know that before, know that now. The healthcare workers that are caring for your health sometimes struggle with their mental health. Hakeem, can you remember the time you asked this particular question? Shey nurse dey fall sick too, in a very sarcastic way, I might add. Or when your brother said, doctors no dey fall sick now. Statements like this are dehumanizing and dangerously wrong. Doctors, nurses, and other healthcare professionals are humans first before their job titles. Now, I only called out Amarachi, Oladipo, and Hakeem. I might not have mentioned your name today, but you know yourself and what you have been doing. And maybe you did not know before, but now you do. Let's replace ignorance with truth and stigmatization with compassion. The healthcare workers that care for you and fight to protect your health sacrifice a lot to do so. The least they deserve is your kindness. I'm Dr. Odi, your favorite mental health doc. In my next video, I'll be talking about the prevalence and factors contributing to mental health challenges in healthcare professionals. Follow me on all my social media, the link is in my bio, and turn on post notifications to stay tuned for my latest posts. Now hold on, before you scroll away. Here's the exercise for today. If you have a friend or family member working in healthcare, I want you to reach out to them today via a call or a text just to check on them. No hidden agenda, no follow-up requests. Just show that you really see them and you care. Drop a heart, a comment to show your commitment, or tag a healthcare worker that you know in the comment section. And I'll see you in my next video.